Hi, my name's Michael Carter. I've worked in HIV and I've been associated with HIV for quite some time. I was diagnosed with HIV in May 1991 and went through the whole process of HIV disease at that time. Became very, very ill in 1994, and I was very lucky that antiretrovirals became available when they did. And I've been on antiretrovirals since 1998 and been in pretty good health ever since, I'm glad to say. I've worked for various HIV charities and been involved in HIV advocacy and patient information since the mid-1990s, most recently as an editor and latterly a freelance writer for AIDSmap.com. But by profession, I'm actually I'm an academic, essentially. I'm a medieval historian. I work for an organisation called English Heritage, which cares for and interprets in historical monuments in the care of the English state. So I have quite a varied range of ideas, and I'm also a research fellow at the University of London. Was I going to be more vulnerable to it because I had HIV? Now, I have very, very well controlled HIV. My viral load has been undetectable since 1998, and I have a sky-high CD4 cell count. But I have a history of very serious lung disease. I had pulmonary tuberculosis, and then I had a really bad multi-drug resistant pneumonia, which made me wonder if, am I more vulnerable to serious respiratory complaints? And very little was known about COVID, about what were the cofactors for disease progression, increased vulnerability. Also the freelance writing I was doing for AIDSmap, I've written a number of articles which has been looking at those explanations for why some people are, and in what circumstances are people with HIV more vulnerable. And some of them are well-established factors that we know about HIV and why some people don't do as well as others. And it's also issues of health inequalities, pre-existing health inequalities. And there is a real thing about COVID compounding those. Now, I'm one of those lucky people who can work at home. People I depend upon for civilization to function. A lot of those people can't. Delivery driver, it's the people who work in the supermarket. And we would have descended into chaos if it wasn't for those people. I'd already taken part in a couple of psychological studies about impact of COVID and lockdowns and things like that, partly just for something to do. I mean, the spring of last year, like so many other people, I was furloughed from work. It was an anxious time, and it was a way of sharing my experience, but also trying to contribute to something which was tangible, that might have an impact, hard, properly analysed data. I was very interested in vaccine research, and gosh, where are they recruiting these people? And then I saw it was a news item on AIDSmap about the fact that the Oxford-AstraZeneca study was opening a sub-study specifically for people with HIV, because they wanted to see what the immunological responses were in the context of HIV infection. And unlike the main study, which was a placebo-controlled study, in the case of the Oxford study, it was another vaccine, because you had to give the chance of replicating the possible side effects and things like that. This was an unblinded study. It means you knew what you were getting, and everybody in the study got the vaccine. And this was in late October of last year. And I immediately got in touch with the study investigators. Now, as far as I remember, I think you had to be on antiretrovirals and have a CD4 cell count above 350 and an undetectable viral load, all of which were easy ticks for me. I think it was the next day. It was very, very rapid. I went to St Mary's Hospital in London, and I had an appointment to see somebody there, and I was thoroughly screened, and all the questions and then some were asked again, and I gave an armload of blood to check baseline levels of, it's like your routine HIV clinic appointment and then some. I wasn't remotely concerned that I was gonna suffer a really serious adverse reaction to this. But this study was so far advanced that I thought, God, they know about potential side effects. They know about safety. This is trying to answer a very specific question about the immune response in people with HIV. They want to see if it works in people with HIV. So I was tested for COVID twice, actually, before I took part in it. And then they took my temperature again, asked me if I had any symptoms. There were really good infection control procedures as well, just to add that at the clinic. And then it was brought in, and it was quite funny. It was the doctor, and then the nurse came in carrying the vaccine in the injection, and it was almost like ceremonially being carried in, like this precious thing, which it is. And then, I took my shirt off, rolled my sleeve up, and it was like, here it comes, swabbed. And then it went in, and I thought, oh, that didn't hurt. It was a little bit of pressure, and okay, it was a little bit sore. And then they pressed against it, and they put a plaster over it, and I had to sit and be observed for 15 minutes in case of an allergic reaction. I don't feel any different, other than, wow, this is gosh, I've just had a vaccine against COVID. That was just wow going through my head. The Oxford-AstraZeneca vaccine has been licensed in the UK now, and is being rolled out, and is probably going to be the mainstay of the UK vaccination strategy. There's already become a kind of good and bad COVID patient, as there was with good and bad AIDS. Some of your listeners will remember this. It was like gay men, drug users, anybody with dark skin who got HIV. That was bad AIDS. Then there were the innocent victims of AIDS. That was like, there was this dichotomy set up. And it was something which was internalized by at-risk communities as well. It's something that happens with lots of diseases. You want to blame, you want to think you're secure. It's a false sense of security you erect around yourself. And it's striking with COVID because of the enormous impact it's having. It used to be this thing, imagine if HIV had affected the general population. Powerful white heterosexual men, if they had been the main risk group for HIV, boy, yes, what kind of a response would there have been? And it has been interesting with COVID, and it's a much larger scale, I get it, and things like that. But the speed of health responses and things like that, how quickly a vaccine was developed, the first time effective vaccines have ever been developed against coronaviruses. And, it makes you ask questions about HIV vaccine development. If there was similar effort, similar international will and effort, would we get at least partially effective vaccine against HIV? It's a very, very important question.